Director of Community Living. Thank you for joining us for the Community Living Family Meeting. Go ahead, Ryan. Are you okay? Perfect. Thank you. Okay, so today we have a long agenda, and we wanted to share the overview of the progresses that we have made in community living in 2024. So before we start, we're going to do a quick introduction. All right, and then afterward, we'll pass it on to Rob to continue. Go ahead, Thalia, and then we'll do Rob and so on.
Hi, good afternoon, everybody. I am Thalia Simpson Clement. I'm the Chief Program Officer here at the ARC. Welcome. Next.
I already introduced myself. Carmelita, are you with us?
Yes, hi, good afternoon. My name is Carmelita Taviado, the Director of Admissions.
Nashawn?
Hello, I'm Nashawn Smith, the Safety and Accessibilities Director. Nice to meet everybody.
Lillian? I know Lillian had a meeting. She may not be with us right now. Keisha?
Hi, good afternoon. I'm Keisha Fells. I'm one of the PCP coordinators for Community Living.
Sierra?
Hello. My name is Sierra Barkley, Behavior Analyst at the ARC PG.
Ryan?
Hi, I'm Ryan Rambarine. I am the Implementation Administrator here at the ARC.
Next, Ryan, you have to keep clicking because I don't have access. Okay, Community Living Directors. You want to introduce yourself? I know the families already know who you are.
Yes, hello. My name is Antoinette Reed. I'm the Area Director for Central Region.
Andy?
Yeah, good morning. My name is Andy E. Hanna, Area Director for the Northern Region. Thank you.
Marie's on vacation. Marie is the Area Director for the Northern, correct?
Yes.
Yes. Next. And this is our Community Living Program Managers. You're already familiar with them. We have Debola, Eustace, Solomon, Michelle, Philip, Sharon, Thomas, Mohammed, Yolanda, Rebecca, Clarice, Anne, Ola, and we have a new PM, Special Price, and Olu Yemisi. So because we are short of time and we have a long agenda, so I'm not going to have everyone introduce themselves one by one. Go ahead. All right, Rob, you have the floor. And Rob is our CEO, and you already know that. He needs no introduction.
Thank you, Missy. You all let me know. Someone give me a signal if my internet access gets slow or anything like that, and I'll turn my camera off to try that. Ryan, if you could stop sharing screen. And Missy, what time do you want me to make sure I'm done?
Oh, Talia gave you her whole time, but we still want Talia to speak too. So about 10 minutes. You have 10 minutes.
10
How's
minutes.
That?
That
is
good?
Perfect.
Yep.
Okay.
124. Okay, so I have some information I want to share. So I'm gonna share my screen. Oh, you have to let me share, Ryan, or make me some special person. Let me just greet all of you and say thank you for tuning in to just connect and hear updates and also ask questions and share your feedback. We definitely want to hear from you. So thank you for tuning in. I'm going to share something I shared with staff or some number of staff yesterday. Not everyone was there. It was an emergency meeting, and I'm going to tell you why it was an emergency meeting in a second. So let me give just some updates and then talk about minimum wage. So there is a mission statement on your screen. And I just want to hear maybe from two family members, not staff, what in that resonates with you, excites you, looks awkward, looks different, anything. Does anything strike you about that mission statement for the ARC, Prince George's County? Just come off mute and just share real quick because I only have 10 minutes.
Empowering people. This is Grace Williams, Joyce Williams' mom from
Hi,
Maiden.
Grace. Hi,
Hi,
Grace.
empowering people. The second one, achieve their fullest potential.
Achieve their fullest potential. Yeah. Okay. You like those words?
Absolutely. Oh, yes. You asked for two.
Okay. Yeah, you like those. Okay. Anything else about the statement, Grace, stand out to you or no?
Maybe
well
you
as-
can you read it out loud, because there are a bunch of people who called in and are only
Oh.
on audio, and maybe
Thank
that
you.
would be helpful. And for the rest of the meeting too, be mindful that since you gave in an audio number to dial in, we're not seeing what you are posting.
Thank you, Rebecca. Yeah, so that's
I mean,
perfect.
I can see it, but I know
Yeah,
another
no, that's
family
perfect.
member.
That's perfect.
Yeah.
Let's keep going, because I did not know people were just dialing in. So yes, so it reads the mission. The ARC Prince George's County is dedicated to empowering people with intellectual and developmental disabilities, as well as other community members in need, to achieve their fullest potential.
I like that.
Yeah.
Okay. All right. Do you want me to tell you what's different about it? Because it's not our current mission statement.
Yeah, I like
Okay.
it. I like it.
What's the new
I-
one?
Well, this is the new one. The new one is the ARC Prince George's County is dedicated to empowering people with intellectual and developmental disabilities, as well as other community members in need, to achieve their fullest potential. Let me highlight why we are going through the process of relooking at our mission and vision statement. It is because the work we do, primary work we do, has really one funding source. And as an organization, it's not always healthy to have one funding source that controls so much of your work, your destiny, etc. You need to have a little bit of diversification in there. So that's point one. The second point is our organization, our staff, our infrastructure offers capabilities to assist not only people with intellectual and developmental disabilities, but others with assistance, much needed service to help them when they're in a bind and they need assistance. An example of that is there are low-income residents that live in our region and seniors who need support getting to medical appointments. And we have vehicles that are sometimes not being used at all during the weekday, and especially on the weekends. They just sit still. And so what we have been working to do over the past year or so is to continue to take these capabilities and to deploy them to meet the needs of the community. And so that little phrase in the middle that says, as well as other community members in need, is a modification. It is a reflection of the fact that we have the capacity and should make sure that we're helping the community at large. The vision statement, which should try to paint a picture of what we're trying to achieve, it's our why statement, says the vision of the ARC Prince George's County, that should be a capital T, by the way. The vision of the ARC Prince George's County is to continuously expand our support to people who were born with intellectual and developmental disabilities and those who face life-changing challenges. Again, a little broader than what you have used to seeing before. Again, a reflection of how we plan to impact the community. Any thoughts on that?
I like the expansion of, including others that are in need.
Yeah, it's a really good idea.
I guess I have a question. I guess my question would be, you mentioned about having one funding source. Does this allow you to have more than one funding source?
It certainly allows us to expand funding sources. And in addition to that, it allows us to charge some fee for service for certain types of activities for folks who might need assistance but can private pay for it. And then for those who cannot pay, we would need some funding source like grants, foundation support, contributions, those sorts of things. Yeah.
I have a question for you. So up here, I'm Sandy. I'm Nathaniel's aunt. We live in Minnesota. I work at one of our trauma hospitals. I work with, it's a community hospital as well. We do have where we have many patients that need help with transportation and so many other aspects. In regards to the transportation, like you were talking about the cars, do you guys have where their insurance helps cover that? Stuff where you can use that funding, like with the insurance, to help cover that?
Yep.
Okay.
Yep, we see the same thing. There are some insurance plans that have a certain allocation of trips, and we can work with them to support those. And then there's some times when those allocations run out and people still need to get to a doctor's appointment. How do they receive that assistance? So yes, you're right. There are some included in plans, but even in those that include it, sometimes you run out of those allocations. So you guys see a little bit here. I put in this threats chart. You guys know the environment is changing. The political environment is changing. I don't care how you voted, but the political environment is changing for disability services. And it's not only changing at the federal level, it's changing at the state level because the state of Maryland has a budget crisis. It's technically a crisis. It's not a shortfall. It's a crisis. And the county also has almost a budget crisis, driven by the cost of what they call the Maryland Blueprint, all that money that needs to go to education funding each year. So funding is going to get tight from that primary source that we've relied on for years. So here's a request. We have and Thalia, I added this in quickly because you might need additional names, you might not. But we would like some folks who are willing to volunteer to be on a strategic planning conversation, to talk more about what we're looking to do in our strategic plan.
Of course, that's what my subject matter is about today.
Well, fantastic. I beat you to it. So
we're right on the same page.
If you're willing to provide more input, to maybe be on a Zoom as a focus group or have a one-on-one conversation with our consultant, if you're willing to do that, put your name and email address in the chat so Ryan or someone else on the team can capture that. Because we're not done yet. We're at the early stages of our strategic plan. The mission and vision statement that you have seen is just a reflection of the early work. So there's more work to do. Okay. All right. I got to keep going fast because I'm looking at my clock and I got 3 minutes. All right. So please do that. So I will say, in addition to that, I want you to know that we already have some things brewing. It is 90% likely that by the time we get to January 1st, the ARC Prince George's team, your organization, will assume the management and oversight of the ARC DC. It's a really small chapter. They really need some help moving forward, and we will assume management of that. We have already done things to help them get their financial house in order, so it's not going to cost us anything to do it. It doesn't really drain our resources, but we will providing the management oversight for that. We are also, I talked about leveraging our transportation capabilities, and we'll be looking for other ways to impact the community. And we will be doing our first ever major fundraising campaign and looking to raise $12 million. That's going to happen because people say, hey, I'll put $5,000, $10,000, $20,000, $100,000 into this campaign because I believe so much in the mission. I'll do that by writing a check today. I'll pay it over 3 years, and/or I may bequeath or leave some money in a will or an estate or something to keep this work going, because we want to make sure no matter what political environment we're in and what we face, we can commit to providing a lifetime of support to the people we have committed to since this organization began. So we have never done that before. I've never personally done it before. It's going to take a lot of work. We're going to run as hard as we can. And our goal is to raise $12 million to fund the work that we're doing now and additional supports and services we want to offer to the community. So it is an exciting time. Even though there's a lot going on, it's also exciting. I'm going to skip that and then quickly ask you all for a favor because I got to get off of here. And that would be, there is a hearing next week. What I can tell you is there is a bill. I think I'm sharing screen, so let me try something real quick. I'm going to just share this with you because you need to see this. There is a bill. Where is the bill? This bill has a lot of sponsors, which means it will pass if we are not saying something. So you remember that phrase, if you're not at the table, you're on the menu?
Yeah.
Y'all know that phrase, right? If you're not at the table, we need to be at the table, because in this bill, which basically says the county wants to have the ability to increase minimum wage every year from here until eternity by the cost of living, the CPI, Consumer Price Index. So every year they're going to do that. But you all know we're not funded primarily by the county. We're funded by the state. And what could happen is people who work at Walmart could make more than our direct support staff, which means we're not going to have direct support staff. And there's actually in this bill a clause that says they can almost exempt us from making minimum wage, so we can make less than minimum wage. So we need, if you're in town, some of you have probably seen the e-blast that came out, the action alert. If you have already responded, kudos to you for being at the table. If you have not responded, I cannot express to you enough. I don't have the ability to say how important this is. This is the most important thing I can think of right now. We have to be at the table. We've got to show up at that hearing. In fact, a little early. The hearing starts at 10, so we got to be there at 9:45. We need self-advocates there. We need folks to sign up to speak. And so to do that, there is a link. I want to put it in the chat when I stop talking so I don't take more time. You will see that link. If you can make it, if you can testify, they probably typically give you 2 minutes to testify. We need your voice. We need to be at the table. And frankly, parents and people who receive supports are better advocates in this case than us, because we're basically asking for money. They think we're being selfish. You need it because you need to make sure you've got consistent quality staff to support your loved ones. All right, with that, I am done. I'll take 1 or 2 questions. I've got to move on. Any questions?
How do we do that considering we're in Minnesota?
You can still,
can we
well, you
voice
can't
it?
testify, but you can email county council members. So do you get our newsletters?
Not always.
Not always.
I don't.
Okay.
I don't get any. I get stuff. I get emails from the house and stuff, but
Okay,
I haven't
so-
seen any newsletters.
And when I say newsletters, I mean emailed newsletters. So what we can do is if Missy or someone on the team, everyone who got the email alert about this meeting, if you could forward them that email alert that shows how to select county council members to email to say, please protect disability services, don't pass this bill the way it's worded. So that's one thing you can do. Even if you can't show up in person, you can't testify, you can do that. Email a council member where your person lives. It has in the spreadsheet, it shows what city is assigned to each council person. So based on their street address, it will tell you who to email.
Would it
Okay,
also
I
possi-
appreciate that.
Okay.
Absolutely.
would it also be possible for you to email not only the person who represents your individual where they live, but also to email the chairperson for the council?
Yeah, Jolene Ivy is the chairperson, so you could email or copy her. Absolutely. All right. Thank you guys for letting me share those updates. I can't tell you how important that is. You will see in the chat once I find it. I will put the link in for those of you who are in town and can sign up to testify. Yeah, even if you don't show up, sign up to testify, because if they see the numbers, they might pull the bill. So sign up to testify. All right. Thanks, everybody.
All right, thank you.
Thank you.
All right, thank you, Rob. Talia, you're on.
All right, fantastic. First, I'd like to just say we're in the season of Thanksgiving, and I want to say thank you to each and every one of you. I've been asked to be brief, and Rob has made it so that I can be a little more brief than usual. And I find myself now on agendas with people whose brevity is probably less great than mine. So I will try to keep it brief, but one of the high level things that we did want to discuss and I want to share with you is exactly what Rob was saying when he started talking about the mission and the vision. That work is coming through our strategic planning process. And so I really wanted to kind of share some of that with you. He did a great deal of that conversation, but also wanting you to know that you will have the opportunity. And I think it's great that we're going to have that information now. We're going to catch you. So not just ask you to reach out to us later, but reach out now. Fill out, say you'll be a part of that process because it's very important. We tend to every 2 to 4 years, we need to take a look at the environment that we're in, where we are, look at what we said we wanted to do previously. How did we do with that? And then we need to share out that information with you. And then as a family, as a group, determine what direction that we want to move in the future. And so with that said, we would like to handhold with you through that process because we want you to be a part of it, want you to give your feedback, give your insight as to what you think things that have gone very well over the last 2 to 4 years and things that you would like to see us work on. And I will tell you that as we have been talking, we wanted to focus in, and I saw what Rob had an actual slide that was going to illustrate what I was going to talk to you about as far as the focus areas. The focus areas for this upcoming strategic plan that through conversation to this point has been that we want to focus in on our personnel. And that's part of why it's so important for you to give feedback, as Rob has indicated in reference to our staff, because it's important that we have competent staff. When I talk to you all individually, you're always talking about your thoughts about the staff. Where you see things that are progressing in the way that you like it, you want that to happen more often. You want us to continue to train staff, and there are many different mechanisms that we're utilizing for that, and I'll talk about that shortly. We want to look at our technology. Technology is giving us the opportunity to expand and do things that we have not been able to do in the past, and allowing us to be efficient at what we do, as well as invite you all to be a part of that process, because we have families now who have chosen to partner with us, come into our electronic system, and I think there's going to be someone that talks a little bit more about that too. But it is allowing us to do things with technology that we've not done in the past, and we want to focus in on just what is out there. We don't want to limit ourselves into what we know today, but what is our future vision for? Because the vision is what we hope for 4 years from now, 5 years from now. Where would we like to see ourselves? So we want to make sure that we're doing that. We also are looking at facilities. As you know, in community living, you should, at this point, I know last year we said by a certain point, you should see certain things happening at the homes. And we have been very blessed to have some additional things and opportunities to happen for the organization, and you will be seeing even more progress in those areas. So we're very excited about being able to provide renovations, home technology, a lot of things that if you notice when you come, we're trying to make sure that people are secure. I know somebody's going to talk about that, so I'm not going to steal their thunder. I'll let them talk about that. But there are lots of things happening with our facilities that will make a difference in the lives of the people that we support. And so we're very excited about that. The other thing is amplifying our brand. A lot of time when we go places, some people, they don't know the breadth of what we do. We are not just providing one service. You know, in that environment, people might say, oh, yeah, if you're looking for community living services, you know about community living services, but you may not know all of the other major services that we're providing in the community. And so we're making sure that across the board, not only will families know, not only will our staff know, because some of our staff are kind of siloed, but we want to make sure that they are equipped and they understand what their colleagues are doing in the program. As you know, we are growing. We have many more staff, and we're going to probably continue to grow because that is also a part of, and actually the last component or pillar of what we're looking at, and that's the organizational growth and service expansion. And so as we're doing this, we want everybody to be a part of that and be able to speak to what we are doing. So Rob talked to you a little bit about the transportation and the vans and what we're doing there. We are also looking to make sure that the staff that you have are competent and they are being compensated appropriately for the work that they do. And of course, staff growth. That is a major area. I think our Human Resources Department has done a yeoman's job of trying to gather the right people to do the work, and then gather people who want to grow in the industry, in the field. They want to know more about what they can do to be effective in their jobs. And we need to be allowing opportunity for internal promotion when appropriate. We want to make sure that we are an employer of choice. We want people to say, when they're looking for employment, I really would love to work for the ARC because I know when I go there, we're going to be well trained. I'm going to get the information that I need to be the best employee that I can be. So those are some of the things that we are doing at a high level. That was brief, I hope. But what I would hope more than anything else is that please, if you're just getting on the line, there is a chat box on the side. We would like for you to put your name and your contact information if you're interested in helping partner with us as we determine what directions we're going with our strategic planning process. It's exciting time. I think as you hear the staff in the that will follow me, I am sure you will be excited about the accomplishments that they have made in 2024, because I am, and we've been very, as an executive team, we have been very proud of the work that the teams have done. So again, thank you for all you do and your support. That's it for me, Missy.
Thank you, Thalia. Ryan, I don't know who's next. Oh, thank you. All right, go ahead, Carmelita.
All right, thank you, Missy.
You're welcome.
Good afternoon, everyone. My name is Carmelita Taviado, the Director of Admissions, and I am excited to introduce something that is going to strengthen the way we work together to support you and your loved ones, and that is the Charting the Life course framework. We call it CTLC for short. This isn't just a new approach. It is a commitment to ensure that every individual we support has the opportunity to achieve their vision of a good life. And we believe that happens best when families and stakeholders work hand in hand. So I mentioned CTLC, or Charting the Life course. So what does it mean? It means that it is a nationally recognized framework that's about collaboration and empowerment. So some of you may have already heard about this, but Charting the Life course, that framework was developed by the University of Missouri, Kansas City. They provide tools and strategies to help individuals and families identify their goals, navigate challenges, and plan for meaningful future. So why am I saying this? Because these are best practices that we are introducing to the people that we support. In fact, the ARC Prince George's County is partnering with University of Missouri to implement this have this foundational understanding of the key principles. So, and it is exciting because we are moving forward. Beginning next year, we will introduce this initiative to the staff, the stakeholders, and as well as families. So there will be more information about this moving along. But I would just wanted to share with you that what does this mean to you? We will be providing tools, strategies, and we will work together with you. And you will see this during the PCP meeting discussions, and we will provide more updates as far as the program. And also this Charting the Life Course initiative is not an overnight process in terms of introducing a person-centered culture within our organization. In fact, this partnership will take about 2 years in order to implement this change. So your inputs will be valuable, and we will definitely share more about this person-centered services with you as we move forward. That's it for me, Missy.
Thank
If
you,
there are any
Carmelita.
questions.
Anyone has any question? No? Okay, go ahead.
Thank you.
Brenda. Is Brenda still with us? Brenda, are
Here I
you with
am.
us?
I'm,
Oh,
I'm
okay,
right here.
Great.
I was punching the wrong buttons. Good afternoon, everybody.
Good afternoon.
I'm Brenda Fitzgerald. I'm the Director of Nursing, and I'm thanking you for the opportunity to allow me to come and just be supportive, because that's our role as the nursing clinical team. There are 6 of us, and we provide support and case management for the individuals in residential, as well as the day and employment services. And we even support personal supports with helping them to identify more services if those are needed. We're continuing with each nurse having about 9 to 10 homes, and they visit those homes and individuals every 45 days unless a need arises that they are out there more often. And they're out there for help to support the clinical, but also to educate and train the DSPs on medication administration, as well as specific diagnoses and the care that is provided for those diagnoses. So we've been COVID stable. We knock on wood for that. And we're doing well. And if you or a family member would like to speak with the nurse for any type of concerns, we are available. And our numbers are present in the homes, and or if you need one, we can provide that information for you today. So, and that's it.
Anyone have any questions for Brenda?
This is Lisa Shames. I do have a quick question. My daughter's at Cedar Hollow. I'm not sure this question should be directed to you, Brenda, but what's the status of the menu planning in the group homes and the dietitian who was supposed to be involved? How is that rolling out?
Well, to my knowledge, every home has received their specific menus for 30 days. And they were taught the different diet preparations and how to cook specific foods like pureed versus chopped. So I believe that has rolled out and has been implemented. But
yes, and it's working out successfully.
Yes. So, but were you having a particular question about that process that's in place, or you don't see it?
Maybe I can answer a question, because it had come up recently that some people were saying that people's menu types or their desires weren't as clear as they should be, and preferences in the area of preference. And so we had the nutritionist to come back. She recently, in the managers just turned in all of their information this week so that she can make modifications to those menus that people felt needed to change, because they have had time to go through the menus, to see what people were eating, see how people were responding to them or not responding to them. And so they're making changes with them, but we have those here for her to pick up this week. So that's where they are. We're making adjustments, and they should be going back out to the homes very shortly.
And that's a minimal number of people, because for everybody else, it's working very well.
Just one quick follow-up. Does that include portion control?
Absolutely. It's supposed to be portion control.
Okay, thank you.
That was the intent. And if that is not clear, I would just need to know that, or the team here would need to know that, if it doesn't look like that's happening. Okay.
Any more questions for Brenda? All right, we're gonna go to Sierra. Thank you, Brenda.
You're welcome.
Okay, 1 second.
Thank you.
Can everybody see okay?
Yes.
Okay, wonderful. Well, hello, everyone. My name is Sierra Barkley Cutting. I am the behavior analyst here at the ARC of Prince George's County. I'll be trying to take a quick 10 minutes to do a brief overview of what BSS, or Behavioral Support Services, are. Just as a general overview for all of the family members that are here. The slides will be shared with you all, so I may go through this information pretty quickly, but those that are audio only for this call, please know that you will be able to see this at a later time. Great. All right, so just doing a brief overview of what behavioral support services are. So this is meant to assist participants within our programs who may be experiencing either short or long-term challenges with their behaviors. And this can be across home, community, employment settings, anywhere. And the point of BSS is to understand these challenging behaviors so that we can then provide holistic approaches, team-based strategies, and so on to help that person in reducing the frequency or magnitude, or just how big their behaviors may be, as well as increasing their footprint as a citizen. So increasing their leisure activities, how they spend their time, seeing if we can get them out into the community a bit more, or even engaging with their peers. The big purpose of BSS is to enhance independence as well as inclusion, making sure that we are reducing the behaviors that may be impeding that sort of social, those social relationships, those bonds, and overall community participation. So behavior support services aim to provide, let me make myself smaller, sorry guys. We aim to provide a comprehensive approach that addresses the needs of individuals as well as their team members in managing those difficult behaviors. So looking at the standards and practices for BSS, again, we do try to follow a holistic approach. So that includes assessments, doing consultations, developing those behavioral strategies to meet the needs of that person across environments. We want to be proactive and use the least restrictive interventions. So that means being in front of the behavior if we can, as well as, sorry, I keep trying to move myself around, you guys. Sorry. Let me see if I can do this. There we go. Wait, no. 1 second. It'll have to work for now. Okay, perfect. So well, we want to be in front of the behavior. So what can we do in the environment within our staffing to reduce the chance of that behavior happening, to reduce what we may call triggers or antecedents that are known to cause these behaviors or really encourage them. We also want to make sure that we're following a tiered behavior support approach. So that goes into our least restrictive strategies where, you know, we're not starting at all with restriction or with restraint. We're making sure that we can change things in the environment first before we are looking to change anything about the person. As we know from research that primarily behaviors are maintained or continue on due to situations that may be present in the environment.
It is very small.
Is it?
Ciara? Yeah, we can
Oh.
barely see.
Okay. Not sure. Let's see. Is that
Yes,
better?
that's great.
Okay, I apologize, everyone.
That's okay. Thank you.
Okay, so how do we do this, right? So first of all, there's Maryland DDA's recommendations as it relates to BSS. And so within BSS for DDA, we follow a framework called positive behavior supports. And so when we were talking about that tiered support strategy of a person getting tier 3, which would be a behavior support plan, or someone getting just general communication supports, which we would call tier 1 or universal. That is the framework that we're operating within. So you're essentially getting what you need when you need it and not more unless the data that we take dictates that. So it's all evidence-based and it's person-centered. We make sure that we start with an effective workforce, which has been a huge focus for me since I've joined the organization, and making sure that we are training our staff to know what to do when various situations arise. And then from there, learning how to enrich the environment with opportunities for great social interaction, for coping and stress relieving strategies or stress relieving activities, and kind of moving up that pyramid till we get to targeted social emotional supports. So working on anger management, working on someone who may be coping with loss, and we're now trying to reduce hoarding behaviors, all the way up to intensive interventions where we are seeing, we are then exploring behavioral assessment and then behavior plans to work with that person one-on-one. All right, so a little quick overview of provider certification and education training requirements. Those that provide behavioral assessment or consultation and create the plans can be a myriad of clinicians. So you can have someone such as myself that is a behavior analyst. You can have a psychologist, a psychology associate, a professional counselor, or a certified social worker. What kind of marries us all together is that we all are master's level clinicians in our own rights. And alongside that, we have undertaken specific training in verbal behavior, behavior modification and reduction, and a lot of trauma-informed care. And there's a little bit more on the slide about our experiences. Maryland DDA does require that we have at least 1 year of clinical experience working with our populations. All right, so the components of behavior support services, it comprises about 4 to 5 different activities or services. So we start off with behavior assessment. So generally based on reports from the team and supporting documentation, someone is referred to myself or another behavioral consultant, to meet the needs or the challenges that they're experiencing. We set up a time to do an assessment, which must be done in person. DDA requires that we have on-site observation of the person just so we really understand what's going on. From there, we're able to write a behavior plan where there's specific goals and targeted strategies to help a person and their team with addressing their needs. From there, the behavior plan is monitored. And that's where we get into behavior consultation. And so we'll kind of do a brief overview of all of these in a second. Oh, and I don't want to leave out BSIS services. That's brief support implementation services, which is where our more DSP level staff have gotten advanced training in behavioral techniques and strategies. And those individuals are empowered to help train the supporting teams in the various behavior support strategies. All right, so what is behavioral assessment? At this point, we are evaluating behaviors. We're trying to understand the person, we're understanding and collecting baseline data, just understanding where the person is now and what could be causing their behaviors. From there, we're able to develop a plan. The purpose, or what is a behavior plan? So a behavior plan is a document that outlines strategies and interventions to help address challenging behavior. There's a heavy focus on the proactive piece and being reinforcing. So again, not focusing on really trying to change the person, but what can we do about the environment to make them feel more comfortable, make them feel more safe, and generally reduce the chance of their challenging behaviors. The behavior plan is regularly monitored by the behavior consultant, and that is through behavior consultation. And behavior consultation is a pretty robust service. As Maryland DDA policy requires, we are to provide at least monthly consultation visits or contacts with the team. And that's for new plans. And once a person has been established and had their first year services, then there's the expectation that consultants reach out quarterly. So if you have not experienced that, if you have a loved one that has a behavior plan and you're looking to get just a little bit more contact with their consultant, let us know. We can get the conversation started. Another piece of consultation is active collaboration. So whether we're going into the office, into a doctor's office to meet with their psychiatrist, if we are working with the occupational therapist or speech language pathologist, we would be comparing and contrasting strategies and seeing how we can work together as an interdisciplinary team to meet the person's needs. So one thing I want to say and be very clear on, BSS, it doesn't just stop here. So we're always trying to work with other folks, other disciplines, just to make sure that we're seeing everything that needs to be looked at for that person. Another piece, of course, is the development of strategies. With those quarterly and monthly monitorings, we're able to see the data. And from there, we're able to make decisions and work with the team on what we need to do next. So if we're seeing that behaviors are starting to spike, we're seeing a much higher amount of them during certain times of the day, then we can work together as a team to adjust schedules, what have you, to make it a bit easier. Alongside the strategy development is the ongoing education of the team, and that includes me, the consultant. And so we're always trying to learn the people that we're supporting as much as we can. We're always looking for new strategies. The most recent research is a really big one, particularly for our folks that may have a dual diagnosis. We just want to make sure that we're being cutting edge while also employing person-centered strategies that are also evidence-based and kind of leaving behind some of those older techniques. All right, so to be eligible for BSS, a person needs to be in either self-directed or traditional services models. Their behavior plan must be approved by the Human Rights Standing Committee before it can be implemented or followed through by the team. All BSS staff need to be trained in the MANT behavioral support system, as well as a few other things as well. And another thing for us to keep in mind is that we can only have one authorized BSS provider at a time, which is very important for our agency, since prior to us getting licensure this year for BSS, we contracted externally with both ARC of Southern Maryland and Humanum to meet our behavior support needs at our agency. And so with that being said, while we do now have an internal person, our folks are still being served externally, which is okay. We do not have plans to, disrupt any standing relationships that are had. So if you have a great relationship with your behavior consultant, you're seeing the needle move in the directions that you need it to move, we're not looking to change that. But we just want to be clear that there can only be one provider at a time. So much of the consultation would need to come from their assigned consultant unless you deem otherwise. And that's it. Any questions?
No? Okay. All right. Thank you so much, Sierra. All right. Next. Oh, it's Ryan. Go for it, Ryan.
All right. Hello, everybody. So I added a few things to your slide, Missy, just for
Great.
everybody,
Thank
so
you.
you know. So I'm the systems implementation manager here at the ARC. Pretty much I deal with technology. I manage our electronic health records. But the biggest thing I wanted to point out is one of our new initiatives, which is family documentation. So I don't want to speak it myself. So I want to call out either Nick or Irene, Grace, Lisa. If y'all want to tell me, because we just had our fourth meeting yesterday about access to your loved one's notes, I would like you to speak on my behalf.
Ryan, I'll speak on your behalf. It has given me access at my convenience to know what's going on with my daughter. And I'm looking forward to sending out my first email through ICM. So you tell me it can happen this Friday, I'm going to give it a try. Or next Friday, I guess.
This Friday. I got you today.
Okay.
Great. Well, anybody else? Nick and Irene, how are you enjoying it? Grace, I know I see you over there.
We found it very useful. It gives us an idea of what's going on in Gabriel's life, who's working with him, the progress that he's making. And Nick?
Well, I find it's very detailed too. You can go day by day, almost hour by hour as to what's going on. And it's a great aid. You can see who's working, when, and what kind of activities are taking place. So I find that to be very reassuring and helpful in knowing that our son is doing well.
Right, and we're also looking forward to family input now. Thank you.
Thank you. Thank you all for that.
Thanks a lot. This is Grace. Thanks a lot, Ryan, for helping us to learn the system. Even though I was used to TheraP from my Joyce's twin daughter, but this is a great system, and I'm thankful and proud that our ARC has this system for our families. I'm sure it will be very useful. It is useful, and it will be very useful for our families. Thank you.
Beautiful. Thank y'all. So that said, anybody interested in viewing your loved one's notes? I'll put it in chat too. You can email systems@thearcofpgc.org. And that's it for me. Thank you.
Thank you, Ryan.
Are we going to be able to have, how easy is the access? I mean,
I have it nice and easy. Easy. I got it easy for you.
Okay. And we use electronic medical records all the time at work. So I just want to make sure it's going to be user-friendly.
It's user-friendly. I'll walk you through the whole thing one-on-one. I gotcha.
Okay. We have my chart, so that's our and Epic and stuff. So I don't know if you're familiar with that, any of that.
That's more doctor-like. Yeah. This one's a lot more user-friendly. I'll say that.
Okay. So if I can use it out, it'll be easy for me. So, all right. Appreciate that. Thank you. It'll be nice to be able to manage it being so far away.
Beautiful. Nashawn?
Thank you very much.
All right. So my name is Nashawn Smith, the Safety and Accessibilities Director. I'll start off with what we are doing for safety for your loved ones. So the first thing that we did was we had rolled out a agency-wide emergency plan. We did this back in October. Currently at the moment, we are training staff on this agency-wide emergency plan to make sure that they know exactly what they do in different types of situations, like fire in the home, severe weather, or even just a temporary relocation just in case. Like I said, we put this in place just to make sure that people have a plan in place just in case of emergency. What we're also doing is essentially looking at the current supplies in the homes, because honestly, we need to make sure that we have.
I can't even. This is
We want to make.
This is not connected. I don't know why.
We want to make sure that we have the proper supplies in the houses. So that means, first aid. That means emergency supplies. That means to-go bags. And it could also mean other supplies that we may need for the house as well for an emergency type situation. What we also did was we actually created a individual emergency plan for your loved ones. So what this is more of a smaller but more visual of what to do in different types of situations. We thought this would be very helpful to give them education on what they can do in a situation as well, because sometimes staff may be maybe out, I mean not out, but I mean like out cold as far as like hurt or something, and they can't get up and move. And so with the individually plan, your loved ones will be able to know what to do and help the staff get out of the house or whatever type situation. So we did that. We also put some other things in place as well as like rings to just ensure safety for each of the locations as well, because that's very important. We want to make sure that people are coming in the house or announce themselves. We see who they are. They have their badge. We know before we invite people into the house. So as far as accessibility, some of the things that we are doing is making sure that all your loved ones have accessibility within their programs. We're doing this by basically speaking with your loved ones, looking at the houses, and making changes as far as like ramps, grab bars, making sure that the floors are flat across the board, doing those type of things, making sure the lighting is bright enough. We don't want the lighting to be dim and then they can't see. So we are doing those type of things to make sure that all your loved ones have accessibility within their homes, because honestly, we don't want it to be to where, they're not able to access getting into the house because of steps, or, maybe the bathroom has a tub and they need to walk in. We're assessing certain things and making changes. And we're doing this with the people that we have, but we're also doing this with the people that are new people that want to come into our organization, because honestly, we want to make sure that everyone has accessibility wherever they go and they don't have to move. Because, from what I noticed being here is that a lot of people have built roots within their community, and it's very important for them to be in their location until the end. So with that, like I said, with all this information with safety and accessibility, like I said, I am speaking with, like I said, the staff and of course your loved ones on what needs to change and what's happening. I am out the programs a lot, just to kind of just see what's happening. We do have a safety committee as well that has different parts of the organization, as far as facilities, as far as HR. QA is a part of that, because we're all supporting one another to ensure that the organization is moving in the right direction. And then also, just to kind of throw this out there, anything that I see that is an issue, or just kind of just want to remind people and stuff, I do send out messages to all the DSPs on things they need to look out for, so that they're kind of getting more education as time goes on, so they're up on things. Does anybody have any questions? All right, pass back to you, Ryan.
All right. So Internet can't make it because she has another meeting she had to attend, but Endurance is going to go ahead and do her part.
Okay.
Endurance?
Right. Yeah, Ryan, I don't see this. I don't see it. I don't see the document.
Should be posted
Now
right
I
on.
see it. Now I see it.
Oh.
All right. Good afternoon. My name is Endurance Hannah. I'm area director for the Northern region. So for home audits, 2 months ago, we had site audits done, which was more of a peer review, where managers were assigned to homes that they typically do not supervise to audit. And after the audit process, the next stage or the next step was for corrective action plan to be done based on the findings from the audit. So that's something we just not concluded. We started 2 months ago, and we're still in the process of correcting those areas that needs corrections done. Nutrition plan, Talia said something about that when she spoke. We have the nutrition book in the house, which was created by the nutritionist and staff. Some of our DSPs were actually trained at the PG Community College on how to portion the food. I heard somebody asking about the portion control part of it. Yes, so portion control is actually part of it. They were trained on how to make puree diet, how to make chopped ones, and how to make mechanical soft meals for our individuals. And recently we just had revision done for individuals who really are not doing well with the plan that was created for them initially. More or less like a modification being done now to ensure that we are actually giving the individuals what they really want. So we're working on that. As Talia mentioned, that document was submitted this week, and the nutritionist will be working on that and sending us an updated nutrition plan for those individuals. Grocery plan as well, which is tied to the nutrition plan. Based on the nutrition plan that was created for each individual, we are also ensuring that on Wegmans, which is the site that we use to order our groceries, that we have uploaded all of these grocery items to ensure that we are buying the correct groceries to make this food for the individuals as well. So that's currently ongoing. Program managers and nurses team development. We did have a meeting with our nursing team to ensure that we are all providing the services that we should be providing to the individuals in terms of clinical needs for the people that we support. And I'd say that that meeting was really as the nurses were able to relate to us areas where they needed us to step up on, and also we were able to relate with the nurses also on areas where we would need them more present with us as well. All in the bid to ensure that the individuals are receiving the best care in the residential setting. We also completed the PCP process and procedures, which is ensuring that we have a roadmap on how to navigate our PCP process for our individuals to ensure that they are not falling out of waiver, they are all compliant, and the fact that they are having their fundings active, because that's how the agency gets the funds also to pay the staff and the rest. So just to ensure that PCPs are all up to date, we have a new PCP coordinator who joined us recently as well to help with the caseload there and to ensure that everything is moving as planned in that area. We have the hydroponic planting program that is currently ongoing at the house. We have the devices provided to us by the agency, and our individuals will be learning how to plant certain plants and crops, I believe. So at this point, they're just navigating their way around it and getting familiar with it. And hopefully we'll be reaping some produce soon from that particular program. Yes. Thank you. Do we have any question?
Yes, who is the new PCP coordinator, please?
She's on here, Legina Turner. That's the,
Hi,
she's,
how are
yeah,
you?
she's on here.
Regina, are you with us?
I'm here. Can you hear me?
Yes.
Yes, we can
Hi,
hear you.
Good. Let me turn the camera on. Hold on. Move my screen. Can you see me? Can you hear me?
We can hear you, but we cannot
Okay.
see you.
Okay, good afternoon, everybody. My name is Legina Turner. I am the new PCP coordinator working with Miss Keisha Fales on the community living side. It's nice to hear your voice, Miss Lisa. I'm very familiar with Miss Lisa. I was the CCS for her daughter.
Okay.
So,
That's great.
So I'm happy to be here, and as Ms. Indy said, I am working very closely with Ms. Keisha to ensure the PCPs are submitted on time. So it's nice to meet everyone.
Thank you so much, Legina.
No problem.
Andy, you want to introduce the staff that's
Yes.
going to replace Mohammed? Because Mohammed wasn't
yeah,
able to
so-
make it either.
Yeah, so Mohammed is not able to make it, so Solomon will be taking this part of the meeting.
Looks like Mohammed's on here.
Yeah, but he
yeah.
had to go to take care of something with Thalia.
Yeah. Solomon on?
Oh, okay. Good afternoon, family. This is sort of impromptu, but I'll do my best to go over this. The first part of this is develop.
I'm here.
In the home.
Are you here,
training
Mohammed?
guidelines.
Yes,
Hello?
I'm here.
Oh, okay. So sorry, Solomon. Let Mohammed do his part.
Good afternoon, everyone.
Okay.
Afternoon, Mohammed, go on.
I'm multitasking. I'm currently at Kavanaugh preparing the guys for the open house that we're supposed to do. So I'm basically multitasking.
Okay, go ahead.
I'm really appreciate to join this meeting to talk about the development in the homes training guidelines for the direct support professional. What Miss Missy actually is trying to do after she been on board is basically to make sure the staff has the proper training so that way they can able to take care of your loved ones, which is very, very important and dear to her. So that's the leadership that we are trying to follow, a footstep basically to make sure all staff gets the proper training to make sure the individual are well, secure, safe, and sound. And the other thing that she also trying to put us in line is concerning for us program manager to have the proper training to know our individual needs and what they don't want, what they would like, or also, and to be aware of the individual intellectual disability that they going through basically. So she's making sure that we know our individual. That's very important. The executed activity engagement. The individual right now, they really love this aspect of the program that Miss Missy is trying to lead us through. They like to go out. And when you know our individual, they love going out. And basically, we as a program manager ensures that that is very, very implemented. If you go in some of our houses, you will see the calendar of their activities. And Miss Missy also ensure us to put it under the ICM for maybe parents to see what exactly the individual are doing day-to-day activity and all that. So we are following our footsteps basically on all what she's trying to implement in the homes. Execute the activity engagement with the family. That one too, we're taking upon ourselves. Once a month, even yesterday, I make a phone call to one of the family member, not knowing that the family member was sick. So she was so happy to hear my voice, basically, to show my concern of her. So basically, we're doing it once a month to check on the family, also to see how they're doing. The excitement on their faces or the smile over the phone is a joy. So if there's anything else, that's for me for now. Thank you all very much.
Thank you, Mohammed. And yes, and they are also providing updates on the individuals when they give a call. All right.
Yeah.
And
yes.
then I'm not the one doing it. It's the team, everyone.
Yeah, it's a team. Yes, it's a teamwork. Yeah, it's a teamwork. But under your leadership.
Thank you, Mohammed.
Yes.
All right, Andy.
All right. Reduce staff turnover in community living, done and is also ongoing. At this time, we have a reduced staff turnover, meaning we're able to retain our staffs. at this point, and we have just few vacancies currently in community living. And what this does for us is the fact that our employees, if they're staying, they're able to provide continuity of care for our individuals, and individuals are able to familiarize themselves with their staff. And that way we have better communication between staff and individual. And then the quality of services provided also is better. So that's what we currently have right now, thanks to the fact that we have just few vacancies currently. And that's also because we've had help from our hiring department. They've done multiple job interviews or job fairs recently. I'll say about 3 we've done this year, if not more, to ensure that we fill that gap of vacancy that we have. Use of technology in the home. Yeah, Ryan spoke briefly, or I'll say about it. Right now, we do have the ring bell system in the houses, and this is very helpful to us as we are able to monitor the houses, the front area of the house, and also internally we have the Oscar Senior. I'm so sure some of us have heard about that before. That's also useful for us to monitor the home internally, or want to look at an individual, or the nurses can actually call in using that device as well to see individuals and to provide maybe remote care to them as well as needed. So that is currently ongoing, and we're looking at also adding more technology in the home as we move on. We also introduced the electronic medication administration system as well. That became active this year, early this year as well. So that's also helpful for us. So we are doing away with our paper MAR. We're not using that currently. We use the electronic one, which is very helpful. And for those who can have access into ICM, I believe they have access to that area. I'm not too sure, or maybe it's just limited to the individual daily notes. Okay. DDA trainings for our for our staff. We're very big on that. We ensure that our staff are actually well trained and well equipped to provide the needed services to the individuals. So if a staff is not in compliance with their training, they are taking off shift. It's important for us that our staffs are trained on the core DDA training as needed. And that they are always compliant with their training and on top of it. So this is being done, and it's also ongoing to ensure that we get to that point where we have that 100% compliance. Hopefully we'll get there soon. Staff appreciation, community living. We had a lot of appreciation events done. We had our DSP Appreciation Week, where we had multiple activities done for our staff, our DSPs, just to appreciate them for all of the work that they do in there. It's not easy. It's a lot of work. It's a lot of patience. It's a lot of passion for them to actually do all that they do for the individuals that we support. And we had, like I said, series of activities to appreciate them for all that they do. And internally, we also have a new system that we're using, which is called Terryberry, to appreciate our employees as well for great work that they do. Company policy review and implementation. We just had our updated company policy given out recently, or handed out recently to the homes. And every location have the most updated policy, and the managers, program managers, and also the area directors, we are reviewing that with our staff to ensure that they know what the policy says for today, and they are following that as well to ensure that we are also doing things properly. Emergency plan and the implementation. Sean spoke briefly about the emergency plan. For each home, it's actually site specific. We don't have the same plan for all locations. It's site specific, meaning that it caters for the need of the individuals in that specific home. It was built in line with their needs. If they're using a wheelchair, if they need some form of alternative way to evacuate when there is an emergency based on their health need. So that was created by, worked on by our safety director, Nashon, who spoke recently. And that includes where they can evacuate to when there is an emergency. It also includes items that they can take along when there is an emergency, and how to evacuate out of the house just to get them to safety. So that's one, another great thing that we have happening right now in community living. Do we have any question?
All right. Thank you, Andy.
Thank you.
Okay, we up to Michelle. Michelle is going to tell us everything that the individuals, not everything, most of the things that the individuals are doing in the community. Go ahead,
Good
Michelle.
afternoon, everyone, and good afternoon to all the parents on. My name is Michelle Lawrence. I'm a program manager for Cedar Hollow, Maiden House, and Lawton. It have a saying that all work and no play will make us a dull person. So we have party for our individuals. We start off with birthday parties. What we do, we have each individual in the homes, we have birthday parties for them. And we also invite the parents to come out, not only in that home, but we also invite other homes to come and enjoy the birthday party and whatever we're doing. Throughout the year, we have various holiday events and celebration. That the last one we had was our end of summer party, where we invite the parents, the individuals were out, the staffs were out, and we had a wonderful time. Also, Halloween party that just passed, we try to make sure that for each, what would we say now, each event, like Halloween or Christmas or whatever, we make sure we have things planned for them. Bowling, we just started bowling on October 17th, and that will go through until April the 4th. All of our individual goes out every Saturday. This happens from Saturday. On Saturdays from 9 a.m. to 12 noon. And all our individuals are enjoying themselves. Also, we have the staff going out with our individual. They take them out. We have in-home activity that we are planning because, you know, it's winter coming on. We will have snow. We will be locked in. So we are making sure that we have activity planned for them indoor. Also, for community participation, we invite our individuals to be a part of whatever decisions we make, so they to know that their voice are heard. We also engage them in the community with work and advocacy. We also had Alco Video Oscar, where we roll out the red carpet for our individual. It's just like we were back in the Hollywood. They deserve it, so we make sure that they're getting it. Thanksgiving celebration, that is in process for Thanksgiving, where we always, and Thanksgiving Day, we take food and other things to each home so they can enjoy themselves, just like how we are enjoying ourselves. Last but not least, we have our Christmas party. Who work in the heart for the last maybe 6 to 7 years will know that we love our Christmas party for our individual. We're rolling that back out this year. So everyone is invited. Family members, you're invited. You know, you're gonna have to pay a little small fee, but it will be at Martin Crosswind, and we are inviting you all to come and celebrate with us. Let's end the year with a bang.
And it's on December 10th.
Yes, that's it for me. If there is any question.
All right, thank you, Michelle.
Okay.
All right. So thank you, everyone. I hope so far you have had a great opportunity to listen to what Rob, Thalia, and everyone else shared with you of what we have accomplished in 2024 and what we have coming up. So for the rest of the plan for this year and moving forward, we're not done with our goals for 2025, but so far we're going to continue to review our quarterly review, documentation, maintenance, nutrition, make sure the individuals are having a meaningful life, transportation, admission, finance, medical, make sure everything that touches the individual's life are reviewed and they are getting the best of care and quality of care. Okay, so, and we're also monitoring and tracking progress, all right? And then now we are implementing regulations, making sure protocols are developed when it is needed, plans, our programs are stable, and then our staff are happy. Okay, and then the next we're supposed to be looking for some homes. We want to continue to grow, and then we're also doing a lot of renovations. And of course, I'm tasked to write a manual. And once it is done, everyone will also have access to it, so you guys could know in detail exactly what we do. Ryan? Okay, perfect. And what do we do for our staff? We told you the fun things that all our individuals are doing. Our staff continues to be trained. We continue to develop them. We continue to have open communication and an open door policy. They participate in different committees. They are engaged with the individuals, and we are teaching them best practices. We have holiday celebration, the SP week for them. I have Natasha here with us for Terry Berry. I didn't know she was going to be here, so I would have put her on a slide for her. But if Natasha has a few minutes, she can tell us all about Terry Berry, because I wanted you guys to know about what we do for staff appreciation. And then so far, our staff are staying with us, and then they are participating. They are wanting to be a member of the ARC, and then supporting the individuals and be part of the change that we are going through. Natasha, can you hear me? Do you want to tell them a little bit about Terry Berry? I saw her. Okay, I don't think she's here then. So next.
Hi, Missy. Sorry.
Oh, yes, that's okay. Great. All right, Natasha, I didn't put you on the agenda because I thought I know you have a lot going on.
I was in multiple meetings, but I will happily share Terry Berry.
Thank you, because I wanted them to hear a little bit about what we're doing with Terry Berry.
Absolutely. Good afternoon, everyone. My name is Natasha Simpson. I'm the QA director for the ARC. I am pleased to share our new employee recognition platform. It's vendor is Terry Berry. We initiated this recognition platform in July. I want to say the 15th of July. The platform affords the staff the opportunity to recognize anyone, each other, their peers, their supervisors. One of the things that I love most about it is the staff are really engaged. In October, we had over 30 recommendations for Employee of the Month, which has been the highest since this has started. So what that said to us is staff, managers, and employees are paying attention to what people are doing that is great and what people are doing to go above and beyond what they're paid to do. And we have quite a few staff who go above and beyond what the expectation is. And so we needed to find a platform where we could show them how they're appreciated, a platform that allows us to demonstrate how valuable we feel they are. On the Terry Berry platform, staff who are awarded, only 10 staff a month are selected, who are awarded the Employee of the Month. They receive 250 points. In the platform, points are equivalent to cash, kinda. And I say kinda because it could be spent in a catalog that's on the platform where they could buy anything from Amazon gift cards to earpods. Someone bought a watch, there's jewelry, there's a lot of different things in the catalog. And I believe our staff are really, really excited about this. And I'm excited for them. This is one of the most exciting areas of my job because I love being able to let staff know that we do hear them, and we do appreciate them, and their value to us is immeasurable.
Thank you, Natasha. I appreciate it.
Thanks, Missy.
Thank you. Okay, the Christmas party. So we are really getting excited about the Christmas party. We are Well, I know that we have a fee, and then I hope that you have already received your invitation and you have already registered. If you haven't yet, please go on and do so, because it's going to be so much fun. I'm looking forward to seeing all of you there. And it's on December 10th at, sorry guys, Martin's Cross Wings. Go ahead, Ryan. That's it. That's all I'm saying about the Christmas party. Do you have anything that you want to share with us? Is there anything that we spoke of that you want more information on? The floor is yours.
Hello, would you have a copy of that county council bill, the CB 088?
Yes, I'll make sure when I send the thank you email, I
Yes,
attach
please.
it for all of you.
Okay.
Yes.
Thank you.
You're welcome.
Hi,
Anyone else?
Hi, this is Grace. This question is for Natasha. Hi, Natasha. How do the parents get the information to nominate staff? Or is it the nomination is only done through the ARC employees, or are the families able to recommend or send the nominations?
Hi, Grace. So right now, this is an employee-only platform. However, I know that you all have great relationships with me and, our managers and our leadership team. So if there's someone you would like us to post on the wall and give recognition to on your behalf, we would be more than happy to do that. You can even shoot us an email, and we would be more than happy to make that post for you.
My suggestion is for us to just, like when we get our newsletters or anything, if you could send it out to all the families of the residents. I think just a few of us are here, but that will be helpful for them to. We have nominated, DSPs in the past to the state, the DDA,
Yes.
the ARC of Midland, and all of that.
Yes.
But within our ARC, it will be helpful, I think, to recognize the DSPs. Thank you.
That's a great idea. I will work with Missy and the team to make sure that we get that information in the newsletter. As our recognition platform grows, we will let you know if we're able to incorporate, families being able to go into the platform and give recognition to staff.
Okay, anyone else? Going once. All right, going. Ryan. All right. So we want to extend our heartfelt thanks to each of you for your invaluable contributions. Your support and dedication to have played a crucial role in helping us improve the services we provide. We couldn't have done this without you guys. We thank you. And then we wanted to make sure that we are working hard to ensure that our individuals, those that we support, are living the life that they aspire. Thank you for participating, and I will see you all March 2025. It was my pleasure, and every one of us here are glad to serve.
Take care.
Thank you. Bye-bye.